Perdón, me salió la reunión, pero ya no me deja ingresar a la sala.
So, Marisa, you're here, right?
Yes.
Okay, as you know, we have 15 minutes each person. Okay, so let's get started. So yesterday we were talking about, well, we talked about two topics actually that were bones and childhood, right? So let's get it started with the first one. Could you tell me the definition of fracture?
Yes, it's the loss of the continuity of the original tissue.
Okay, of the bone, right? Of the bony tissue. When we're talking about bone, right? When we're talking actually about tissue, okay, it would have to be bony tissue, okay? Bone means hueso, right? On the other hand, we have bony. You instead of writing the final e, would have to be replaced by an y. Okay, so it would be bony, which actually would mean óseo. Okay, so it would have to be, since you were talking about tissue, it would have to be bony tissue. Okay, that is correct. Could you tell me any sort of classification according to any kind of, well, first let's talk about types of bones, an anatomical classification of bones. We already talked about it yesterday.
There are the large bones, the short bones, and the flat ones, I think.
Okay, there are four groups actually. There's one left.
Irregular ones.
Irregular. Okay, irregular. And the first one you said large, right? Large actually means big, right? In this case, it would have to be largos, right? And what would it be then? Instead of large that you said, what would it have to be?
Like other name?
Actually, it is not large bones. It is well, large. Sorry.
Long bone.
Yes, great. Because actually, large means like big, right? Long has a kind of different meaning that a certain diameter is bigger than the other, which would be a long bone, not a large bone, okay? Could you give me two examples of each one of these types?
Yes. The long bone could be the femur, the radius.
Okay, what was the first one that you told me?
The femur.
Okay, that is the correct pronunciation, femur. Okay, great. What about short bones? Could you tell me any example?
The ones that are on the wrist and the ankles.
Okay, yes, they're close to the wrist. Could you tell me the anatomical name of that kind of bones?
Mm,
In Spanish, we call them
carpo, metacarpo.
carpo, right? And in English would be?
The carpo.
Carpal, okay? C-A-R-P-A-L, carpal bones, okay? And what about the ones that you told me near to the ankle?
Tarsal.
Tarsal, great. Okay, great. And what about the flat bones?
Mm, that could be the parietal.
Okay, it would be parietal, right?
Parietal and the
Yes,
occipital.
occipital bones. Okay, and what about the irregular bones?
Mm, maybe the pelvis.
Um, Actually, those would be a different kind of bone. When we're talking about irregular bones, there is no predominance in any axis. So maybe it could be a better example would be what kind of bones do we have in our spine?
The mm,
You know what
like
the spine is, right?
yes, the columna
Okay,
vertebral, right?
great. So what are the bones that are associated with this?
Uh, I don't know how how do you say that in
In
English?
English, okay. Okay, you could name those bones in two different ways. The first one would be vertebra, which is similar to Spanish, right? And the second one would be vertebral bones. Okay, so yes, that
Okay.
would be an example. So now, could you define the what the spongy bone is?
Sorry, I didn't listen. I had to do something.
O-
What was the question?
Okay, could you define spongy bone? Do you know what it is?
Mm, is the part of the bone that is on the inside, I think.
Inside, okay. It has one important organ right there, right? Which is the bone marrow. You
Mm-hmm.
know, could you tell me what bones are associated with bone marrow, especially? Because not all of them have bone marrow,
The,
especially when we're grown-ups, right?
the long bones.
Okay, and is there any bone that is more related to it? Because, well, in hematology at least, we tend to use some specific bones to get the bone marrow as a sample, right? Well,
Maybe the femur.
there is bone marrow in the femur. However, there are two main bones that are most commonly used to extract to have a bone marrow sample that are uh, one is in our chest and the other in our hips.
The ribs.
No, what is no? What would be the other?
Uh, es- the sternum.
The sternum. Okay. We sometimes get a bone marrow sample from the sternum. Okay. And what would be the other?
The pelvis, I think.
Okay. Yeah. Okay. Okay. Those two bones, right? And what about compact bone? Um, it is like layers, right? That surround the sponge bone. So compact bone has well yes has like different names, and also the sponge bone has some other names that is known by. Do you know the other names that are related to sponge bone?
The spongy bone.
Yeah.
Cortical bone?
Vertical bone is like the compact bone, right? That is around the sponge bone. The sponge bone, as you told me, is inside the bone. So the sponge bone has some other names because when you read any English or U.S. literature, medical literature, you could find any of these names that are related to sponge bone. So do you remember any of them?
Maybe the trabecular bone, I think.
Yes, great. Trabecular bone. And the other one?
Oh no, I don't know the other one.
Okay, then that is great. For you to remember is cancellous bone. Okay, so now let's talk about growth and development. So what is the main difference between growth and development? They're always go together, as I told you, but they're different concepts, right?
Well, mm, the growth is more like uh, how the baby or how the kid is just growing up, and the development is like the things that what he or she has to do during that growing.
Okay, so growth is more related to size, right? This
Yeah.
size increasement and development. It's like some abilities and that this baby or kid tends to get according to the age, right?
Mm-hmm.
Could you tell me the importance of this topic, growth and development? Because the first thing you have to do when you get to pediatrics is to know to how to recognize a healthy child. So could you tell me the importance of this topic?
It's important because we need to know how that child if that child will be healthy or not.
Okay, so when we're talking about some diseases that are related to, well, there's a disease that does not allow um, either growth or development in a kid, in a child. Could you tell me any disease that decreases or makes growth or development slower?
Mm, for example, I don't know how to say in English, but the syndrome de Down could be.
Okay. Could you tell me some characteristics about Down syndrome? When you see a patient, what would you find?
Well, we can find like mental retardation, maybe the single palmar crease.
Okay, yes, like the horizontal one, right? There's the only one. Okay. So any other?
They usually have short hands too,
Okay. What about
and
the tongue?
uh, uh, his tongues are usually small and arched palate
Actually,
and big too.
they're actually big. Yeah. So what would you call that sign? That's actually a sign, right? What? How would you call that sign? That is a bigger tongue than usual.
I don't remember.
In Spanish, maybe.
No, I can't remember right now.
Okay. So in Spanish would be macroglossia, right? And so you're going to tell me tomorrow uh, how this would be pronounced in English, okay?
Okay.
Okay, so we're done with our 15 minutes. And do you have any doubt about pronunciation? That is the most important because all the rest you're going to see it in your university. So do you have any doubts about pronunciation or different terms that we talked
Mm,
about?
no, I don't think so.
Okay, so thank you. First, don't forget to join at the end of the class for the daily survey, okay?
Okay, thank you.
Okay, thank you. Bye. Hello, Denise. How are you doing?
Hello, doctor. I'm okay, thanks.
Okay, great. So, give me 1 second. So from now on, we have 15 minutes. So yesterday we were talking about two topics, which were bones and childhood, right? So the first one would be bones. So yesterday we were talking about some medical equipment that is related or that are related to fractures. Could you tell me the three that we talked about yesterday?
Um, Excuse me, what about the fractures? I I didn't understand.
Okay. Yesterday we were talking about fractures, right? And at the
Yes.
beginning of the class, I had one slide that had three medical equipment that were related
Oh,
to,
yes,
okay, what were those three?
yes. The first one, the crutches. These are medical devices that are designed or made to aid in ambulation, mobility. Um, these have the crutches transfers the weight from the legs to the upper body and are used by people that cannot use uh, their legs to support their weight. The other one is the cast. It's like a shell made from most commonly plaster or can be um, made uh, uh, no, um, from plastic. No, yes, to stabilize and hold anatomical structures, um, like well, a patient who has a broken bone.
Okay, so it would be for immobilization purposes, right?
Yes,
Okay, so what about the last one?
the stretcher.
Great.
It's like it. The function of the stretcher is to moving patients who don't who can't move or require medical care. Maybe they are unconscious or
Okay, great. Yes, you remembered all those three. So yesterday we were also talking about an anatomical classification of bones. Do you remember what types of bones we talked about yesterday?
yes, we talk about the short bones, the long bones, flat bones, and irregular bones.
Awesome. Could you give me
The
two examples of each one?
not the concept, right? Just examples.
Yes, just examples, because I know that you already know this kind of stuff. So just give me
Mm,
examples.
uh,
That would be it.
short bones. Uh, carp, uh, carpal bones, tarsal bones.
Okay.
Like I have to give you the name of.
Mm, uh,
I
when
just
you're
remember.
talking about the short bones, right?
Yes,
Yes,
I
that would be great. Yes, so it's carpal bones and tarsal bones, as you said. Any other about the other types of bones?
the long bones, the femur, um, the I don't remember the names of the forearm bones.
Okay. What about
Radial, right?
the radius? Okay.
Right. Okay.
Okay, great. What about flat bones?
The flat bones, the parietals, the occipital, frontal,
Awesome. Those that
irregular.
are related to the cranium, right? The flat bones.
Yes.
And
Also
the last.
can be the scapula.
Okay, great. Yes, scapula. What about irregular bones?
The regular bones. The vertebra, ver-
Yes, great.
can be. We talked about yesterday, and we talked about another group of bones. Um, the sesamoid. I don't know how to say it.
Yes, you were doing great. Yes, that is correct.
Um,
Sesame
or
bones.
the sutural bones
Great.
also.
Yes. Do you know have you ever read about this kind of bones related to Aymara culture?
Excuse me, can you repeat that?
Okay. As I was telling you yesterday, there's a relation between this kind of bones that you told me and the last ones, and that are
The
related to,
sutural.
yes, to Aymara
Um,
culture.
oh yes, I read a little bit of that Wormian bones that were um, they found. I don't know, like I know there are like Peruvian
Yeah.
mummies. I don't know how to say it. That had this kind of bones, a lot of them in their cranium.
Yes.
Um,
Okay,
yeah,
great. Actually, once I saw an occipital bone that was almost made of this kind of bones. There were like 20 or more these little
well,
bones, and it moved like a worm when you touched it. It's like they all moved because they were all obviously connected. So when you move the inferior part. It's like a worm. It was moving like a worm. It was great. I took a
That's why
picture.
the name.
Yeah,
Wow.
it was great to see. So yesterday we also talked about some other classification of bones. Could you tell me the difference between the spongy and compact bones?
Mm, I remember about the spongy bone that is also called trabecular bone. It we can find this bone in every bone, but we find this type of bone in the long bones, also the short ones and flat ones. Um, we we found the red marrow here.
Okay, the bone
Is
marrow. Yeah. So what bones are most commonly used to get a bone marrow sample in an adult, in a grown-up?
can you repeat that again, please?
Yeah, sure. When we're treating a grown-up and we, for example, a person who has a diagnosis of leukemia, right? We need to get a bone marrow sample. So what bones do we usually use to get a bone marrow sample?
The long bones, the femur. No, I'm not sure.
Okay, there are two main bones. Okay, the one that is on your chest, what do you think would be?
And sternum. No,
Great, yes. We use
sternum
the sternum to get a bone marrow sample. And what about the other one?
is a flat bone.
You told me the sternum, right? And there's
Yes.
one other bone. Sorry, my dog's playing around here. We have one other bone that is usually used to get a bone marrow sample.
Mm, I don't know.
Okay, you're going
Um,
to tell me that tomorrow, okay? Actually, you usually use the sternum, but it is more usual to use this other bone, and you're going to tell me tomorrow, okay?
okay.
Okay,
Okay.
so
Um,
when we talk about fractures, we we talked about some different classifications. Could you tell me any of them and tell me what this classification is about? The one you tell me.
um, um, one one of was the fractures according to a previous state when the um, with the previous healthy bone and and the other an ill bone, and we talk about the pathological fractures here.
Great. Could you tell me any kind of disease that might be related to pathological fractures and not
I
cancer?
think I think the most common would be osteoporosis.
Awesome. Great. Do you know what kind of drug, what kind of medicine osteoporosis would be related to? If a person uses one certain kind of drug for a very long time, it would cause the disease that you told me.
Um, no, I don't know.
Okay. When a person has a long-term use of corticosteroids, Okay, for example, those people that have, for example, rheumatoid arthritis, right? They use corticosteroids for a very long time. They decrease inflammation, that is why they use it, right? However, on the other
Yeah.
hand, they tend to get this disease, um, osteoporosis. So um, that would be it. So talking about the next one, we also talked about childhood. Could you tell me the difference between growth and development?
Well, the growth is the increase of the size, the physical size, and development is the increase of the functions of the body. The you know, um,
Okay, great. They are according
yes,
to an specific age, right? At certain age, they are supposed to do something. At another age, they gain another ability, right? Yes, you're
yes.
right. Why do you think this topic is important?
Mm, growth and development.
Yeah,
And it's important because it help it helps us to um, identify a problem in um, identify a problem at and I don't know. um,
okay. So
and
it is actually more useful to identify a healthy child, right? Because sometimes when they have certain chromopathies, they tend to have a lower or slower development, but they increase size, so their growth is kind of normal, but development is not. So it would be useful in that kind of diseases. So we already achieved our 15 minutes. Thank you, Danitza. I'll see you at the end of the class, please, to join the survey, okay?
okay, thank
Okay,
you.
thank you. Bye.
Bye.
Hello, Danitza, are you there?
Yeah, hello, good night.
Hello, how are you doing?
Fine, thank you.
Okay, so give me 1 second. Okay, from now on, we have your 15 minutes to practice your pronunciation and all that kind of stuff, okay? So, yesterday we were talking about two topics, right? Bones and childhood. Uh, we were talking specifically about fractures and childhood, respectively, right? So, well, let's talk about the first one. So yesterday we were talking about some medical items or medical equipment that were related to fractures. Could you tell me the name of each one? We talked about three.
Three topics. Um,
No, three items, like three kind of objects that were related to fractures. Do you remember?
Is the crutch?
Okay, crutches, yeah. Do you know what crutches are, right? Could you explain a little bit?
Mm, is I don't know. I don't know in English.
Okay, what would a person use this for?
When a person had a fracture or mm, how do you say luxación?
Okay, displacement, like maybe, okay. Yes,
Placement?
okay. So what would be the main purpose of crutches?
Uh, is for the leg. So,
Okay, for support, right? When a person cannot walk, tends to redistribute the weight to, instead of the lower limbs, take the weight to the upper limbs, right? What
yeah.
what part of the body would the crutches go in the patient of in a patient's body?
Can you repeat, please? I don't not hear.
Okay, so we already said that it has support. Well, it is actually related to support, to give a better support to our patient that cannot walk, for example, right? So, what part of the body would this go under of a certain part of the body? Do you remember what the axilla is, right?
Yeah.
Do you know any other term that it means the same?
I don't remember.
Do you remember the term armpit?
Yeah, is
Yes. Okay.
man.
So then what about the next item would be the cast, right? We talked about it yesterday. What is it used for?
Um, the cast es ensanchece el yeso, ¿verdad? El yeso que se pone.
Yes, that's a cast. What is it used for?
Um, when the people broke your arm,
Okay, what is the main purpose? When we talked about treatment of fractures, we said that we have some specific points, which were pain management. Right after that, we had immobilization, right? So casts have this main purpose, which is related to immobilization. Remember, right?
yeah,
Okay, and what about the last item? Do you remember? Do you remember what it was?
is a stretcher.
Great. What is a stretcher used for?
Uh,
Are you still there, Danitza? Hello. Danitza, are you there? Hello, Danitza, are you there? Okay. Danitza, are you there?
Yeah, I'm sorry, my connection is very, very bad. The
Yes.
que me logró escuchar o no?
Yes, I can hear you.
The structure is, thank you, used to carry for a person.
Okay, great. A person who, for example, has just lost consciousness, right? Is unconscious and or might have been involved in an accident, for example, and that can, well, should be transported by a stretcher, right? So we're also talking about some the classification, the anatomical classifications of bones. Could you tell me the four main types of bones?
Is for long bones, short bones, flat bones, and irregular bones.
Okay, it would be irregular. Okay, pronunciation, it would be irregular. Okay, so could you tell me two examples of each kind of bones?
Okay. The long bones is, for example, in the leg or arm. For example, femur.
Femur, okay, femur, okay.
And the short bones are is in the how do you say mano?
Hand or a specific part of the hand, right?
Mm, Muñeca.
Uh, that would be wrist, right? So here we have in Spanish, what would you call that kind of bones in Spanish?
Oh, huesos del carpo.
Great. So in English would be carpal bones. Okay, carpal
Also,
bones. Yes, and one in, there's another example that I told you yesterday, and that are similar in our feet. What kind of bones were those? As if we're the same, right? When we were talking about the hand, we say carpal. In our feet, we have the
metatarsos, metacarpiano.
we have the tarsal bones. Okay, because actually metatarsal bones are long bones. So when we're talking about short bones, it would have to be tarsal bones, right? So we were also talking about different types of bones related to their structure. Could you tell me what do you what comes to your mind when we talk about sponge bone and compact bone?
Okay.
So
The
what is
sponge is also called cancellous or trabecular bone.
Okay, trabecular, great. Yes.
Compact bone is the other name is cortical bone. Um, uh, um, the compact bone.
Okay, so we have the compact bone and the spongy bone, right? You also told me that is known by the name of trabecular bone. Yes, great. So we were talking about some kinds of fractures that were, well, classification that was related to the previously state of a bone, right? You remember?
Uh, can you repeat, please? I don't know here.
Okay, so yesterday we were talking about some classifications of fractures, right? And one of them was related to the previous state of a bone. So we had um, um, fractures that were related to a previously healthy bone, right? And fractures that were related to a previously ill bone. Do you remember that?
Yeah.
Okay, so in the second example, we already talked about pathological fractures, right? Could you tell me a little bit or give me an example of any disease that might be related to a pathological fracture and that is not cancer?
Uh, for accident.
Mm, what do you understand by the term pathological fracture?
I understand is when break in a bone, when this caused by underlying disease.
Okay, it would be actually a fracture that is related to a bone that was already ill, had some kind of disease that made this bone weaker than usual. So when this person has any kind of disease that makes his or her bones weaker, does not need a high energy trauma to fracture this bone. So there are fractures that are related to healthy bones. For example, in healthy people, in young people, that is the kind of fracture. And in patients who have, for example, do you know this disease that I will tell you, multiple myeloma? Do you know this kind of disease?
Yeah.
So multiple.
Other example, can osteoporosis?
Great. Awesome. Yes, osteoporosis is a disease related to pathological fractures, right? So, could you tell me any drug or medication that might be related when it is used in a long term? When a person uses this medication, one certain medication for a long time, so for a very long time, it might be related to osteoporosis.
Sorry, and my connection is very bad.
Okay.
No logro escuchar muy bien. Se escucha entrecortado.
Okay, don't worry. What about now? Do you hear me now?
Yeah.
Okay, so there's a lot of medications. However, there is one that is more related when it is used in a long term, and they're related to osteoporosis. Do you know what medication it might be?
The medication is okay?
Yes. What medication is related to osteoporosis when it is used in a long term, for a very long time?
Oh, it depends, but the most common is
Yes.
the uh, uh, I don't know how do you say tabletas?
Um, what kind of medication? I need a name of medication. Well, let me tell you, for you to read, okay, you're going to read it by tomorrow. It will actually corticosteroids, in Spanish corticoides, right? When they are used in a very long time, for a very long time, they tend to cause osteoporosis. Okay. Okay, so we're done with our 15 minutes. And remember to join at the end of the class, please, for the daily survey, okay? Okay,
Thank you.
Danitza, thank you. Bye, see you later. Hello, Diana.
Hi.
Hello, Diana, how are you doing?
Very good.
Okay, so give me 1 second. Okay, so from now on, we have 15 minutes for you to, for us to talk, okay? And of course, we're going to focus on your pronunciation and vocabulary. So yesterday we were talking about two topics that were bones and childhood, right? And we specifically talked about fractures and childhood, and sorry, and growth and development, respectively, right? So when we were talking about fractures, first we talked about some items that were related, or medical equipment that was related to fractures. Do you remember the name of these three items that we talked about?
About three. Can you repeat that?
Yeah,
Please?
sure. Yesterday we talked about three items. That were are related to fractures, medical items, medical equipment. Do you remember what were those three?
Um, Crutches.
Great, yes. What about the
Uh,
second one?
I forgot the name in English.
Okay,
Um,
a cast, right? Cast.
that was the that isn't the bed, right? The bed, like the one that is like a bed, is the next one, right?
Ah, yes, the stretcher. You mean the stretcher, right?
Yeah.
Okay, so those three. Could you name them again, please?
Crutches,
Great,
cast, and the stretcher.
great. What are those three items used for?
Um, the I forgot the I'm sorry. The crutches are for when you fracture your like your leg and your feet.
Okay, so it would be like for support purposes,
Yeah.
right? Yes, to give support to our patient who can't, yes, you gave a good example, might not be able to use his or her legs, right? So what
Yeah.
about the next one? Cast. What is it
Um,
used for?
when you fracture your arm or your, I don't know if you can use it for your wrist.
Okay, what is it used for? Yesterday when we were talking about the treatment of fractures, the first one was related to mm, pain management, right? And right after that, we had immobilization, right? You remember?
Kinda.
Okay, it was so a cast is related to immobilization purposes, right? So, for example, when a person has a fracture that is complex, it might have small fragments of bone for them not to move, right? To make them stay steady. So that would be immobilization. So a cast is used for immobilization purposes. Okay. And what about the last one that you told me that seemed like a bed, right? That are as a stretcher. What is it used for?
I think that is used when you like when the fracture is, I don't know, como peligrosa, and you need to stay in the hospital.
Yes, great.
uh,
Okay, could it be also used for any other purpose different from fractures?
yeah.
Could you tell me any of those different uses?
Um, every hospital room has one, so um,
Okay,
you
great.
stay there after a surgery,
Yeah.
or yeah.
Okay, great. So we were yesterday. We were also talking about some classifications of fractures, right? And we talked about, for example, one classification that was related to mm, previously the previous state of a bone. Do you remember that, Diana? Are you there?
um, really not that much.
Okay.
Um,
Yesterday we were talking about some classifications of fractures, right? And one of those classifications was related to the previous state of a bone that suffered a fracture. For example, a bone that was previously healthy is like a regular fracture, right? Like people who are healthy usually have this kind of fracture. However, there is, do you remember the term pathological fracture?
no.
Okay, so pathological fracture is when bone uh, is fractured, right? Suffers a fracture. However, this bone was not healthy when it was not broken. So pathological bone, sorry, a pathological fracture is actually when a fracture occurs in a previously ill or sick or a bone that had a disease previously. Do you understand?
So, if when like you don't do un movimiento brusco that makes the bone fracture.
Not really. Well, let me explain it to you in Spanish, okay? For you to understand
Okay.
completely. Una fractura regular, por así decirlo, es una fractura en la que el hueso no tenía ningún defecto previamente a la fractura, pero una fractura patológica de lo que estamos hablando ahora ocurre en un hueso que previamente ya tenía una enfermedad que lo hacía más débil que un hueso normal. Esa es la definición, digamos, de una fractura patológica. So this is a pathological fracture. So there are some kinds of diseases that make a bone weaker than usual. Okay, so that is a pathological fracture, a fracture that occurs in a bone that was previously was not healthy, was actually ill, an ill bone. Could you tell me any kind of disease that might might be related to a pathological fracture?
I remember there was a disease. Called, I don't know. I remember for a book, Huesos de Cristal. I don't know if that is
Yeah,
the name of the disease or.
yes, that is actually a great example. That makes bones, all of the bones, right, really weak. So it does not take a lot of energy in at all. Does not need a high energy trauma to make those bones break, right? Diana, are you still there?
Yeah.
Okay, so you gave me a great example. That disease makes our all the bones weaker than usual. So it does not take a lot of energy in a trauma to make them fracture. Okay, so yesterday we were also talking about growth and development. Could you tell me the difference between those terms? Diana? Diana, are you there?
Yeah, but I'm thinking. I'm sorry.
Okay, don't worry. So yesterday we were talking about growth and development, right? Do you remember?
No,
Okay,
not
what
really.
do you know the term? You know the verb, right? Grow, Grow.
Yeah,
So, what about the term growth? Growth, right? Growth. Could you tell me the translation in Spanish? What would growth mean?
crecimiento.
Great. So, what would you relate growth to? I mean, what do you understand when you hear the word growth?
em, ya las etapas de crecimiento.
Okay, it's actually related to size, right? How they grow, the how they tend to get bigger, right? And we have a lot of measurements concepts. However, growth is actually related to size, okay? How they get bigger and bigger and bigger every time. So what about the term development? What do you understand when you hear this word? And what would it be in Spanish, development?
I listened to that word a lot of times, but I never searched translation.
Okay, it would be, in Spanish would be desarrollo. Okay, so in Spanish, we have this topic, which is crecimiento y desarrollo. So the first would be related to size, how they get bigger in many aspects in size, right? And development actually is related to the abilities. This these children tend to develop as they grow. So, for example, we were talking about some development issues yesterday, such as being able to grab objects, being able of keeping his or her head steady when they're seated, that kind of stuff. What do you think this topic is important for?
To guide people that have ay, que acaban de tener un bebé. Well,
Okay.
that in like in the profession.
Yes, as a doctor, why would this topic be important for you that you're going to be a doctor? Why is this topic important?
Yeah, for that to help people that I don't know, que recién tiene a su bebé o que es primerizo.
Okay, it actually would be important for you to identify a healthy child. Okay, because sometimes, well, let's take an example, which would be Down syndrome. You know about Down syndrome, right? It is related to, well, they grow slower than usual, but their development is highly, well, it is more affected. Uh, Let me explain another way, in another way. So, when a person has Down syndrome, they might grow as a little slower than healthy people, that those people that do not have this disease. However, their development is highly affected. So they might reach a regular size, but they do not have a regular development, okay, for the age that this person has reached. Okay, so it is important for you to identify healthy and non-healthy children. Okay, when you get to pediatrics, at the university, you're going to see that a lot because that is the main topic to identify a healthy child. Okay, Diana, so we're done with our 15 minutes and I'll see you at the end of the class for the survey, okay?
Okay.
Okay, bye. See you later.
Bye. Bye.
Marcela Guzman, are you there? Hello, Marcela.
Hi,
Hey, how are you doing?
I'm fine. How are you?
Thanks. Yes, I'm fine. Thanks for asking. So, give me a second. Okay, so from now on, we have 15 minutes to for you to talk and focus on your pronunciation and vocabulary, okay?
All right.
So yesterday we talked about two main topics, which were bones and childhood. And we talked about some specific topics that were fractures and growth and development, right? So let's get started with the first one. Yesterday we were talking about mm, some items that were related to fractures, some medical items that were related to fractures. Could you tell me the name of those three items that we talked about yesterday?
It will be like cast, I think. There is. I need to explain it or just say it.
You're going to explain me later. You
Okay.
first name them, tell me the names of those, and
Okay.
right after that you explain what it all is about.
Well, it was cast crashes. I think it's the pronunciation, and there is another one that it's stretcher. I don't know if I'm good on the pronunciation. Can you help me on that, please?
Okay, so it would be stretcher. Yes, you were saying it right. And the other one was a cast. And what was the other one?
Yeah, crutches. It's the one that help us when we broke, for example, the leg
Yeah,
to
the
walk.
crutches, right?
Okay, crutches.
Crutches, yeah.
The U, it's like O pronunciation, right?
Yes, crutches, yeah. That one, right?
Okay. All right.
Yeah, so what are crutches, casts, and stretchers used for?
Well, the crutches are like these are like some support that when, for example, I broke my leg or any part of my leg, anything, and so it helps me to as a support to for me to walk. Um, yeah, it's
Great. Yes, it's like for support purposes, right?
yes,
What about the cast?
because it's also like support, but this is for the bone. The doctor uh, use this cast to, for example, if I broke my radio or something or any bone, it will help me like keep them like without any keep them safe to make any move. I don't know if I'm explaining it all well.
Yes,
You know,
I
okay.
understand. It would be like immobilization, right? With
Yeah,
when we were talking yesterday about the treatment of fractures, the second item was immobilization. So A cast has immobilization purposes, right?
Yes. And then the other what we talked about, it was the stretch. It's like a bed, but it helps. Well, they are mostly on the hospitals, and it helps to move a patient from point one to point two, for
Yes.
example.
Yes, great. It is. It might be also used for people who are unconscious, right?
Yes.
So, great. Right after that, we talked about some anatomical classifications of bones. Do you remember the four main types of bones?
They are short ones,
Great.
uh, long bones, and also there is irregular bones, and I think flat bones. But I didn't get it at all. What it's like, which kind of bone it will be a flat bone?
Okay. So a flat bone is as it's. Do you know what flat means, right?
Um, yes,
How would you describe this word, flat?
it's like when the the superficie. How can I say superficie?
Surface.
The surface of anything, it doesn't have like any mountain or something like that, for example.
Great. So a flat bone is just like that, a bone that is like very thin, right? Do you know the word thin, right? Thin.
Yes, it's something that is really small, but in a size that, um, for example, when someone has low weight, it will say this person is thin.
Great. Yes. So that is what flat bones are all about. They are thin bones. Okay. So it would be. So could you give me two examples of each kind of bone?
Okay, long bones are the more easy one. We have like humerus. Also, we have a radio.
Okay, the humerus and the radius. Okay. What about
Okay,
short bones?
the short bone, it could be the. Oh, I forgot how do you say it's the word for this one. Carpianos and metatarsianos.
Okay, it would be in Spanish. You said it right. It would be actually they're kind of different. They're carpal bones and metacarpal bones. Actually, carpal bones are short bones, and metacarpal bones are long bones. So there are two rows of bones that are related to the wrist, right? Those two rows. Do you know what a row is, right? ROW.
I think, but I think I have that like idea, but I'm not completely sure.
Okay, so in our wrist, the wrist is a joint, right? And here we have the two main bones of forearm, which are the radius and the fibula, right? And here we have in our hand, there are two rows of bones that are the carpal bones. Those are short bones. Okay. What about the other example that I told you yesterday about short bones?
Um, well, I think you say the hips bones, they were, no, I'm wrong, right?
Sorry, what kind of bones did you say?
Hip. The bones are over the hip.
Okay, actually, the short bones would be the tarsal bones, right? And that would be almost the same as in the hand. We have the carpal bones. In our feet, we have the tarsal bones, right?
Okay.
Okay, so what other kind of bone are we missing?
We're missing the well, irregular bone.
Okay, so could you give me two examples of that?
The vertebrae are an example.
Okay, yes, awesome. So yesterday we were also talking about the classification of fractures, and one of those classifications was related to uh, the previous state of a bone, right? We
Uh-huh.
talked about a fracture that was related to a previously healthy bone, and a fracture that was related to a previously ill bone. So when a fracture is related to a previously ill or sick bone, how do we call that kind of fracture?
Um, I missed that part. I'm sorry because my internet got a little bit um, like fell
Okay.
the signal. So
Okay.
I'm so sorry.
Yeah, don't worry. Yes, it could happen to any of us, right? So, do you know the term pathological fracture?
Yeah. Mm, I think I have an idea about that.
Okay, could you tell me?
It's when, for example, I have a previously yeah um, ill in, for example, as there is a type of cancer that goes over the bones.
Yeah.
And for example, when someone has this type of cancer, it's more easy to this person to have has a fracture.
Yes, great. You have the right concept. It happens in a previously ill bone, right? So there are some kinds of diseases that make the bone weaker than usual, and it might not take a lot of energy, or might not need a high energy impact or trauma to make this bone break, right? Could you tell me any other example besides cancer that might be related to a pathological fracture?
Mm, I don't know if this could be an example, but for example, if someone has broken um, this bone before and then it happens again, I don't know if it would be like a little bit weaker the bone before because of the first fracture.
So you
It's
mean
not.
like this person might have had a fracture, and uh, to have another fracture in the same place, like the
Mm-hmm,
first fracture made the bone weaker than usual?
mm-hmm,
Okay, actually, when this patient is like healthy, in a term of 4 to 8 months, if this person is healthy, and let me emphasize that, there shouldn't be any kind of scars or make this bone weaker than usual. So, do you know this disease? Did you ever read about multiple myeloma?
never.
Okay, so it is actually a kind of it is a disease that is related to B cells. Okay, and these B cells, you know what B cells are, right? B lymphocytes. So when B lymphocytes get activated, they can turn either into memory cell, right? Or a plasmatic cell, also known as plasma cell. Plasma cells, when they start functioning, they release antibodies, right? And those antibodies, for example, go to a patient's cranium, okay, and
Mhm.
they activate the immune system, and the immune system starts to attack the bone of this patient. So after a long time, this bone gets weaker than usual because of this immune process. Uh, if you can read could you read it for tomorrow? Maybe just a little introduction part of multiple myeloma, even in Spanish, and tell me about it, a little bit about it tomorrow.
Multiple myeloma, you say?
Multiple myeloma.
Oh,
It's
myeloma.
let me tell you in Spanish for you to look for this disease, myeloma múltiple. Okay,
Okay.
so you can read about it just a little bit and tell me why we ask for a lot of X-rays. We ask for a serie, no recuerdo el nombre exactamente en español, pero se pide radiografías del cráneo, de costillas, o sea, de tórax, o sea, de esqueleto axial, ¿no es cierto? O sea, de todo el eje, de todos los huesos relacionados con el eje y del cráneo, porque todos esos huesos están afectados por el mieloma múltiple, en el que las células B producen anticuerpos y se unen a células de los huesos. Entonces el sistema inmune ataca a los huesos, entonces se pueden producir fracturas patológicas. So by tomorrow, if you could read a little bit about this disease and tell me about it, would be awesome. Okay?
It will be after the class, right? Or
During the class, I think I already asked to some of your classmates about some other. Well, I asked some other questions to all of them, so I'm going to be asking each one of you. I do not want you to read the whole topic. Just a little introduction to know what this is all about. Okay.
all right.
Okay, so I'll see you at the end of the class to for the survey. Okay.
Okay.
Okay. See you
All
later.
right.
Mariana, are you there? Mariana Sanquines, are you there? Hello. Mariana Sanquines, are you there? Mariana Sanquines, are you there?
Yes, I am.
So, hey, how are you doing?
Fine, thank you.
Okay, so let give me a second. Okay, so from now on, we have 15 minutes for you to talk and get rid of all your doubts about pronunciation and vocabulary. Okay, so yesterday we were talking about two main topics, which were bones and childhood. And we actually talked about fractures and growth and development, respectively, right? So we were talking about fractures. We began with some items, some medical items that were related to fractures. Could you tell me what those three items were?
Yes, um, crutches, cast, and stretch.
Okay, so what are those
And
items used for?
uh, could you please repeat the question, please?
Yeah, sure. What are those three items used for?
Well, they are part of support the patient. Well, well, um, crutches are support for walking, and cast is used in bone fractures. And I have a question about stretcher. What was the translation to Spanish?
It would be camilla, right?
Okay, yes. And stretcher is used to an item that is in the hospital where the patients go and take seat or sometimes uh, the word and they sleep or they get attended there.
Okay, so as we were talking, as you told me, the second one, the cast, it has like an immobilization purpose, right? And the third one, yes, to take a patient from one point to another. And it would also be related to not only trauma, but also to, for example, an unconscious patient or an unconscious person who, for example, might have just had an accident, right?
Mm.
Okay, so we were also talking about some classifications of fractures, and one of them was related to the previous state of a bone that suffers a fracture. Uh, there are fractures that are related to a previously healthy bone and fractures that are related to a previously ill bone. Do you know the term related to a fracture that might be related to a previously ill bone?
No.
Do you know the term pathological fracture?
No. Mm.
No? Okay, so a pathological fracture is when a fracture occurs in a bone that was previously ill, had, well, there was some disease that made the bone weaker than usual. So it wouldn't take a lot of energy to break that bone. That is a pathological fracture. Okay, do you get it right?
Yeah,
Okay,
it wouldn't take long.
sorry?
What I mean is a pathological fracture wouldn't take long to have a fracture.
No, it would be like, for example, The first one, regular fracture, let's call it that way, would happen in a healthy bone, right? For example, a healthy person who does not have any kind of disease, right? Like a young person who was practicing any kind of sport and suffered a high energy trauma, right? And broke a bone. On the other hand, we have this patient that might have had already any kind of disease that made his or her bones weaker. For example, osteoporosis. And that disease made his or her bones weaker than usual. So it wouldn't need a lot of energy to break that bone. It's like a soft impact would be enough to for the patient to have a fracture. Now you get it?
Yeah.
Okay, so could you tell me any kind of disease that would be associated with a pathological fracture?
Well, it could be cancer, and I don't know how to say it in English, but could be also a reason, osteogénesis imperfecta.
Great, awesome, yes. So, what kind of cancer would be related to it?
Bone cancer.
Okay, any other that might be related to metastasis?
I really don't know about that.
Okay, so for example, prostate cancer and lung cancer tend to reach the bone. So they would be related also to pathological fractures, okay? So in male patients that are in the third age might have this kind of fractures. Okay, so we also talked about some other classifications according to the structure of a bone. So could you tell me what spongy bone is and compact bone is?
Okay. And spongy bone is what is inside of most long bones. It's surrounded by compact bone, and that could be the definition.
Okay, great. Okay, so when we talk about spongy bones, this kind of bones is related to bone marrow, right?
Right.
So, for example, we might have a patient with the diagnosis of leukemia, and we need to get a bone marrow sample. What bones would you go for to get a bone marrow sample in an adult, a grown-up?
Well, I really don't know about that topic, but I think that it could be the femur.
Okay, there are two bones, okay, that you might use to get a bone marrow sample. The sternum, okay, the sternum, and the other one you're going to tell me by tomorrow, okay? You're going to find out what it would be, okay?
Okay.
Okay, so yesterday we were also talking about childhood, and specifically we talked about growth and development. Could you tell me the difference between those two terms?
Well, growth, it's about the increase of a size, respectively. It could be in physical size, and development is an increase of something, but in a, I think it was a qualitative increase
I didn't get that last part.
or
Sorry.
quantity.
It's like develop. Okay, you were right about growth. Like it's the increase in size, right? There are a lot of measurements that we might use to talk about size increase. On the other hand, we have this development, which is more related to function, right?
Yeah.
Okay, so what do you think this topic is important for you as a doctor? I mean, you're going to be a doctor. Why do you think this topic is important?
Uh, well, I'm the physical therapist. But in my career, it would be so important because when we see uh, children in general, we want to give them their it's a individualidad
Okay.
in their growth, just like it like when they are 1 or 2 years old, what things they should be doing to have uh, calidad de vida.
Okay. So, as a yes, you're right. As for us to understand better, it would be like important for us as doctors to identify a healthy child, right? Because sometimes when a child has some kind of disease, one of them could be more affected than the other. For example, some diseases are more related to slower development. However, they increase in size. They grow almost as usual as healthy kids would. However, this disease would affect more the development of a child. So you have like a regular sized person but does not have a good, a normal or regular development, right? Could you tell me a disease that might um, affect development instead of growth?
I am not sure, but I don't really know about that topic yet.
Okay, but for example, PCI, do you know what PCI is in Spanish?
No.
Okay, you're going to tell me that by tomorrow, okay?
Okay.
Okay, so we are done with our 15 minutes and remember to join at, yes?
It was PC. What? PC
In Spanish,
one?
PCI, okay?
Okay.
Okay, so remember to join at the end of the class for our daily survey, okay?
Okay.
Okay, thank you. See you
Thank
later.
you. See you later.
Hello, Paola. Are
Hello.
you, hey, how are you doing?
Fine.
Okay, so Give me 1 second. Okay, from now on we have your 15 minutes. Of course, we are focusing on pronunciation rather than anything else, okay? And vocabulary. So,
Okay.
yesterday we were talking about two topics, which were bones and childhood. And
Yes.
specifically,
Can you
specifically,
explain me?
yeah,
Yes. Can you explain me about large bones and short bones, please?
okay, yeah. Uh, what do you understand by the word long? Do you know what long is, right?
Yeah. I remember yesterday that long bones is the bone is extensions with other bone, right?
Sorry, I didn't get it.
Yes.
Could you repeat that again, please? Hello?
Okay. I remember the large bones is the bone is extensions with another bone. It's
Actually,
like
okay, go on.
um okay. It's I remember the long bones, especially the femur and tibia.
Yeah.
I don't know, are subjected to most of the load during daily activities, and they are crucial for skeletal mobility.
Yeah, they're actually long bones are more related to limbs, right? Because as their name says, they are long. So one of their main axes, you know what axis is, right? We also talked about it, is bigger than the other. For example, in long bones, the vertical uh, size is much bigger than the horizontal one, right? That is what large bone is. That one of the axes is much bigger than the other. In this case, the vertical axis in those examples that you just told me, uh, for example, the femur, right? That is actually a long bone. Okay, so what about the other one, the short bones?
I don't know that short bones. I don't remember that the short bones, the definitions, and I would like that you explain more about short bones.
Okay, so uh, when we were talking about large bones, right? There was a main axis that is bigger than the other, right? For example, in femur
Yes.
or the other, you said that I think it was humerus, right? I don't remember. So those those bones are larger because they are their main axis
Ah,
is vertical, for example, and the other axis,
in horizontal, right?
yes, rather than the
Okay,
horizontal.
okay.
So the opposite would be a short bone, in which the horizontal and vertical axis are almost the same. So we have a short bone.
Okay, I understand that long bones, it's like connections with another bone, and short bone it's like an individual bone, right? I remember that the short bones can be the crane, muscle crane, uh, for example, parietal, temporal, or sagittal bones.
Actually, those are flat bones. yesterday we talked about four kinds of bones,
okay.
right? Those were the long bones, short bones, flat bones, and irregular bones, right?
And the difference in the flat bones in short bones, what is different?
Okay, flat bones are actually thin. You know the meaning of thin, right? Thin.
No, I don't know the
Okay,
concept.
okay. So thin actually means delgado. Okay, so
Okay, okay.
flat bones are thin bones. So thin bones are related to cranium bones. You gave good examples about flat bones. You were saying, could you tell me again those flat bones that you talked about?
Temporal bone, sagittal bone, occipital bone, parietal bone.
Okay, it's actually parietal bone, and temporal bone is not flat. It's not a flat bone. When you were in anatomy class, there is the squamous part of of the temporal bone is actually flat, but we have the petrous in Spanish, la porción petrosa, right, of this bone is actually makes it it makes it an irregular bone. Okay,
Okay, I get
so
it.
okay, so the flat bones that are related to the cranium are that are flat bones would be the frontal bone, parietal bone, occipital bone. Temporal bone is an irregular bone. Okay.
In the vertebra, it's irregular too.
Yes, you're right. And what about short bones? You didn't give me any example about them.
Yeah, I remember the short bones is the phalanges, scarp, escarpo, el carpo.
Okay. Okay.
I don't know.
Okay,
Yes.
so you told me carpal bones. Yes, carpal bones are short bones. Okay, and what about the our feet? What bones do we have in our feet that are short bones?
The the feet,
Yeah.
the bones of the feet. I know I don't remember the names of the bones of the feet.
Okay, when we talked about the hand, you said carpal bones. What
Yes.
in our feet we
It's
have the
um lo tengo en la punta de la lengua. What do you say? Lo tengo en la punta de la lengua.
okay, it begins with a T.
Okay. I think that the bones of feet, phalanges. No, really, I don't remember the name. I'm so nervous right now.
Okay, it would be tarsal bones, right? Was it tarso, right?
That's
Tarsal
right,
bones.
metatarsianos. That's right.
Actually, there's a difference between tarsal and metatarsal bones. Tarsal bones are are short bones, and metatarsal bones are actually long bones because they are long, right?
Yes, yes.
Okay, so tarsal bones and carpal bones are short bones. So we were also talking about some classifications of fractures. You remember, right? And one of those classifications is related to the previous state of a bone. Do you remember what a pathological fracture is?
I remember the bruising, swelling, deformity, and crepitus.
Okay, that is the what we might find in a patient with a fracture, right?
Yeah.
However, I was asking you about, do you remember what a pathological fracture
Yeah,
is?
yeah. I remember.
Okay, could you tell me?
It's like when a person's fall. I don't know, when a person fall in in another place, right? In any place, and the bone hurt is very hard, and the bones break. I don't know what to say. The fracture, it's occasioned due to the impactions, impactions from the glass. I don't know. I think that is I'm so close to the factories. I remember that the classifications. It's fragmented. Um, I don't know the other.
Okay, so
Uh-huh.
yesterday we talked about this kind of classification that was related to a previously healthy bone and a previously ill
Yeah.
bone, right?
Yes.
What about the
Yes.
second one? What? How do we call a fracture when it happens in a previously ill bone?
Um, I remember that the classmates say the cancer.
Okay, and do you remember what
I rem-
your classmate said?
uh, I remember only. I just remember only that she said the cancer the in bones, and after you say the spongy bone and the compact bone.
Okay, that is a classification according to the structure of a bone, right? However, here we are talking about fractures. And a pathological fracture is when a fracture happens in a bone that had been, well, is weaker than usual due to a disease, for example, osteoporosis, right? Osteoporosis makes a bone weaker than usual, so it wouldn't take a lot of energy to break that bone. That is a pathological fracture.
Okay.
Okay, so
Now I don't know the disease because I'm no carry this matter this subject pathology.
okay,
Uh,
yet.
I yes.
Do you,
And
did you read about anything about pharmacology yet?
no, I don't the upper study this subject until next year because I'm second
Okay.
year. Yeah,
Okay.
but however, I learned a lot with you, and I'm so grateful because I learned a lot this in this course.
Okay, you're welcome. That's what I'm here for, right? So,
Thank you.
okay, so well, let me tell you something that might be useful for you. Okay,
Okay, thank you.
when a patient might, for example, a patient who has been using corticosteroids, okay, in Spanish would be corticoides, right? A patient with, for example, rheumatoid arthritis, they tend to use this medication for a long periods of time. And this medication, in a long term, they make, well, they make bones go weaker. They cause, this medication might cause in a long term osteoporosis.
Sorry, wicked in Spanish.
Okay. Okay, the translation.
Yes.
Okay.
Yes.
Okay, weak means débil. Okay.
Oh yeah, I remember yesterday that you said this word.
Yeah.
Thank you for remembering.
Okay, don't worry. So weak is débil. So in some, well, a patient that might be using this kind of medication, which is corticosteroid, corticoides, right? And like dexamethasone or that kind of medication for a long periods of time make uh, well, could cause osteoporosis, which cause bones to get weaker than usual. They are weak, and when a person is using this kind of medication for a long time, might be having this disease, which is osteoporosis, and when this patient has this disease at the end, well, after using this medication for a long time, might not need to have a high energy trauma to break this bone. Okay.
Yes, I read this topic in physiology, the corticoids.
Yeah. Yes. In English would be corticosteroids. Okay.
Okay, corticosteroids.
Yes, corticosteroids. Okay, so we reached our 15 minutes, and please join at the end of the class for the daily survey. Okay.
Okay, thank you.
Okay,
See you
you're
soon.
welcome. See you later.
Bye.
Bye. Valeria Guerra, are you there?
Good night.
Hey,
Hi.
Valeria, you're always the first to join the meetings, and you are always the last one to
Yeah, why?
participate due to your name, right?
Why I'm the last one?
Yeah, because of your name, right?
No, I don't think so. My name is my last name is
Yeah,
your
yeah, but in
my name, not by last name.
yes, your profile name, right?
Yeah.
Yes. Okay. So yesterday we were talking about. Well, give me a second. Okay. So from now on we have your 15 minutes.
Okay.
Yesterday we were talking about two main topics, which were bones and childhood, right? And the main topics actually were fractures and growth and development, respectively. So let's get started with the first one, which was fractures, right? And when we talked about fractures, we began with an anatomical classification of the bones. Could you tell me the four main types of bones?
Long, short, flat, and irregular.
Great. Could you tell me or give me two examples of each kind of bone?
Sure. Long bone may be femur, tibia, and fibula.
Okay, it would be femur. Okay, femur.
Femur. Okay.
Yeah, and fibula.
Femur, fibula. Okay.
Great.
Fibula. And short, the carpals and the tarsals, and the metacarpals.
Carpal and tarsal bones, right?
Yes.
Okay.
And lats, the ribs, the cranial bones, and the I don't know what is the correct pronunciation for sternum or sternum.
Yes, you're right. Sternum.
Okay, sternum. And then the irregular bone, maybe the facial bones and the vertebra.
Great. Yes, you're right. We were also talking about some other classification of bones according to the well, we were talking about spongy and compact bone, right? Could you tell me a little bit about those two? Well, we were talking about the structure of bones. We had spongy bones and compact bones. Could you tell me a little bit about those?
The spongy bones are the ones that they fill the inner layer of the bones, of most of the bones.
Okay, spongy, right?
And the compact are the ones they fill the outer layer.
Yes, great. So when we talk about the spongy bones, we always relate it to bone marrow. You know what bone marrow is, right?
No, what is it?
Bone marrow is médula ósea. Okay.
Ah, okay. Bone marrow. Okay.
So when we talk about spongy bone, we relate it to bone marrow, right? So when we, for example, we have this patient with the diagnosis of leukemia, okay? You know what leukemia is, right?
Mm-hmm.
Okay, yeah. So when we have this patient, we may need to get a bone marrow sample. So what bone would you consider to get a bone marrow sample? There are two bones mainly that are most usually related to getting a bone marrow sample. Do you know what those two bones are? Okay, it would be the one that you told me right before. It was the sternum, and the other
The
one,
sternum?
yeah, and the other you're going to tell me tomorrow, okay?
Okay.
Okay, so yesterday we were also talking about some classifications of fractures, right? And one of them was related to the previous state of a bone. When a fracture occurs in a bone that was previously ill, what do we know? How do we know this kind of fracture? Do you remember?
What if see I just remembered that someone says about cancer or something like that.
Yes,
But
that
I
is.
don't remember the word.
Okay. Do you remember the term pathological fracture?
Pathological fracture.
Do you know what this is about?
I think it was okay, a broken bone caused by a disease.
Okay, it could be, yeah. It is actually a disease, okay, that makes the bone weaker. You know what weak means, right?
Yes.
Okay, so there's a disease that makes bones weaker than usual. And since they are weaker, they might not need a lot of energy to break these bones. For example, osteoporosis, right? Could you give me another example besides osteoporosis and cancer that might be related to a pathological fracture?
Related, maybe. No, I don't know another. Bueno, no sé, porque leukemia is also cancer. I don't know.
Okay. Have you ever heard or read about multiple myeloma?
No.
Okay. This is a disease in which, well, it is related to B cells. You know what B cells are, right?
Yes.
B lymphocytes.
Mhm.
So what is the main function of the cells? Could you tell me?
The B cells
Yeah.
are the ones that are in the that are responsible for the production of the immunoglobulin. I don't know how to pronounce.
Okay, it will be like antibodies, right?
Uh-huh.
Making it easier. So when a B cell is activated, it would have two pathways. One would be a plasma cell, right? That is related to the production of antibodies, right? And the other one would be a memory cell, right? They are both, they both come from the from a B cell, right? So when this B cell that is takes the pathway to become a plasma cell, as you said, it um, produces antibodies, right? These antibodies reach some bones, especially cranium bones, okay? And they attach to the bone and start an immune reaction and make the immune system to attack the bone. And we have this weakened bone.
Mhm.
Okay, so by tomorrow, could you read a little bit about this disease, which is in Spanish mieloma múltiple? Okay,
I didn't hear.
sorry.
Uh, I don't know. You had I think, a bad connection or interference. I didn't hear very well.
Okay, and what part
Oh,
you didn't
what
catch?
was it called, that disease in
Okay,
Spanish?
okay, it would be mieloma múltiple.
Mieloma. Okay.
Okay, so by tomorrow you could read just the introduction to know what it might be all about, okay?
Mhm.
Okay, so right after that, we talked about childhood and growth and development. Could you tell me the difference between growth and development?
Grow. Growth is. I don't know how to explain it. Maybe that development is growth is like to increase, to progressive increase, and development is like I understand the difference in Spanish, but I don't know how to explain it.
In English, right?
Uh-huh.
So
Development maybe the increase of, I don't know, functions or getting skills.
yes, you're right. It is actually more related to functions and skills. Yes, that are might be related to a certain age, right? A determined
Uh-huh.
age. And growth is more related to the increase of
Stage.
size, right?
Size. Uh-huh.
Yes. So in some diseases, mm, one of them is more affected than the other. For example, some chromosomal diseases might have a little more disturbance in development rather than growth. Could you tell me any other disease?
No, I don't know to be sure. To be honest, no, I don't recall.
Okay. What about, for example,
Uh-huh.
Down's disease or Down syndrome?
The Down syndrome is when the baby has an extra chromosome, the 21.
Yes. Okay. So what do you think it would affect the most? Growth or
How?
development?
Ah, um, growth.
Actually, development would be more
Development
effective.
first.
Yes.
Ah,
Yes.
por
Some
las.
some people might reach regular size. However, it
Their
is
state of mind.
yes, great. Yes, you're going the right way. Yes, it would
Mhm.
affect more the development, right? Rather than
Yes,
the
like that,
growth.
like auth autism.
Yes, great. Yes,
Mhm.
it's like a social disorder, right?
Disorder, exactly.
Yes, you're right. So, what do you think this topic is important for you as a doctor?
It helps us to determine to have to determine maybe the in an early stage the disease.
It could be, yes.
Uh,
However, the main point of this topic would be for you to um, identify a healthy and a non-healthy child, okay,
mhm,
for a determined age. Okay, so what you when you get to the pediatrics subject, uh, the first thing you have to do is how to recognize, how to identify a healthy child. And
mhm.
this is the main topic, okay? Growth and development. Okay, so Valeria, I think we are done with our 15 minutes. Uh, remember to join at the end. Oh, you're the last one, right?
Yes,
So,
I'm the last one. So,
okay, so wait, please, okay? It's for the others to
okay,
join. Okay, so give me 1 minute and I'll tell the others to join us.
okay.
So guys, there are only 7, no, there's only 6 of you right now. At the beginning of the class, I think you were 9 or 8. However, we cannot wait any longer for all the others to join for the survey, okay? So we're only going to do it with the ones that joined back. So let me know when you're done. Here we go. Okay, thank you guys. So I'll see you tomorrow and have a good night's sleep and see you tomorrow, okay? Bye guys.
Bye. Good night.
Good night.